Hi there, everyone. Thank you for joining me. My name is Carla, and I am your relationship doula, helping men and women bravely birth peace in the pieces of their lives. Now, my daughter just reminded me there's so many things that October's for. It's Domestic Violence Awareness Month. It is what we're talking about infant pregnancy and infant loss awareness, and it's also Breast Cancer Awareness Month. And so I did not get someone to talk about that, but a friend of a person I know is doing a comedy show. She's a survivor of breast cancer, and she's called The Truth of It. So I think I posted it on my site. If not, I'll post it on there. But I bought my little ticket. It's virtual, $5, support the cause, to just hear and support those who are battling through, who have survived breast cancer and who are going through it. But today we're going to talk about infant pregnancy and infant loss. And I am glad to have, she happens to be my daughter, but she does know things. She is a nurse, and I'm going to let her introduce herself.
Hi, I'm Rebekah Lewis. I'm her daughter. I work as a registered nurse in maternity and infant care. So, seeing pregnancy and infant loss, being able to share resources and ways to help families be there for those who have experienced an infant or a pregnancy loss.
And how can they follow you on social media?
I am at Little Ones Lactation on Facebook and on Instagram. So you can look me up and follow me for great information and tips on things from pregnancy, parenthood, and children.
Okay, and hi, Therese. Thank you for joining us this afternoon. So, guys, I'll definitely upload it to my YouTube channel, Coach Carla Henry Lewis. But if you know someone who has gone through a loss, um, feel free to share it with them, because sometimes you can feel so alone in this journey. And I wanted to have Rebekah talk to us about that, because we found out that October 15th is their awareness date, isn't it?
Yes. So in many places, so it's an international day that they do light a candle. So many places have different ceremonies where they'll have everyone come and do like a candle lighting and address pregnancy and infant loss on October the 15th. I know a lot of different organizations are doing it virtually this year. So that is a way that you can participate and light a candle for an infant or pregnancy loss and be there to support others in your family that may have experienced this.
And we're going to put up a resource so that you can have that as well too. This particular site is a foundation, the Star Legacy Foundation, and they have great information. You could even change your Facebook profile temporarily for those who have had that or in support of. Even though you may not have experienced it, you may know someone who wanted to have a child and may have had miscarriages, and they may have eventually been able to have a child, but that still is a loss for them. So I wanted to talk about what the etiquette is, because sometimes we can fumble and hurt people when they've gone through a loss. So what are some of the etiquette things that we should keep in mind when we're talking to someone who's had a loss? You know, before you go on, I've heard people say, oh, it's God's will. And I'm like, is that really the best answer we can give someone?
So a lot of times you have to be cautious with your words, because you may think that is a kind comment, saying things along those lines, but sometimes it can be hurtful for that person to have that loss. Being present, acknowledging their loss, addressing their loss, however they preface it. Some will like you to address it by the baby's name. So if you know the name of their baby or what they were planning to name their baby, addressing this was their child that they lost. Being thoughtful and being prepared to be present with them. You want to make sure you're treating them as a person. This is a loss for them. Sometimes they're going to be open to address this and discuss this with you, but if they're not, that's fine. Everyone grieves in their own different way. it's just certain things that you want to be careful not to say, because it can, like my mother just said, it's God's will. That can come off, or you can have another baby. Those things can come off as hurtful and condescending, or now you have an angel. There's certain things that you want to watch your words, just because you may think it's thoughtful, but it hurts. So they're grieving, and they are entitled to have that time to grieve as long as they need it, for as long as they need it. Some parents will take pictures, some will have a funeral, depending on what they need to grieve. Working in the hospital, we do offer those resources to families. So a lot of times we do have things so that they can dress their baby up in a gown, and we can take pictures of them and their baby, and so that way they can have these mementos, because this is their only time with that child. Letting them grieve and be able to have these keepsakes from the loss that they've experienced, and being there to support them through this journey.
I said, I like when you share that. And one of the things that I like when I'm doing these conversations with Carla, and what I want us to practice a little bit more, is compassion. And so often we can be very cruel. It could be indirectly or directly. Many times someone may have lost a child or may not, and we tend to want to comment on someone's weight. Oh, you're pregnant, or you're not. So again, being mindful of those kinds of comments that you could make to a mother who may have lost her baby and was unable to carry it to full term, because there's different types of losses that Rebekah has educated me about, where you can bring a child to full term, and it could be a stillborn, or it can die shortly after birth, may have complications. And then there's SID. Explain what SID is.
Oh, so sudden infant death syndrome. So it means that they do not have an explained cause to the death that your infant has experienced. So it could be that your baby dies and they can't answer it. So a lot of times they'll label it as SIDS. We're hoping with more evidence they can give more causes to SIDS, but a lot of it is they look at different things, and if they can't find a cause, it's called SIDS, sudden infant death syndrome. So it can be hard. So some people, they don't have any answers or of why this happened, except that. So grieving the loss of a child and addressing that comfort, because a lot of times there's things that affect that. They've had a baby, your baby's in your home, you have all these things that bring memories of your baby. So helping to be present with that person, be compassionate, know that they're addressing their grief, and sometimes they just may need space, or they may want to talk. So being open to listen and hear what they have to say.
And I like when you say that, because many times in these situations, somebody just needs you to listen. They want to be able to talk about the little fingers or the different things. And so if you can be that friend, if you can be that person that can listen to them and say their name, because I'm just going to put a plug in here for therapy. One of the things that can cause stress on a couple or a relationship is once there's been an infant loss, once there's been a pregnancy loss, because if you're not careful, someone will try to blame one or the other for the loss, or your partner may say, oh, because you weren't doing this or doing that. And so you can feel many emotions. Yeah. And you may need to seek counseling. You may need to seek a therapist to have that conversation with. If it is causing stress in the relationship, have a couple session so that we can talk about that, so they can mourn the loss, because many times a lady who's experienced that, they're thinking many times, is it something they did? And wanting to talk that out, because they may think it's their fault. And so finding your support system to do that is very imperative. Now, do we have any, I know there's all kinds of support groups around, but as far as, because again, I put that Star Legacy Foundation on there. So they have different facts and information on there. One of the facts that I saw on this particular site is that the amount in a school bus, 70 children are born each day who are stillborn, you know? And could you imagine that if that was that wife or that mother? And recently, to kick off this month, we had a celebrity who experienced that.
So I believe that some people found out that Christy Teigen, who's been sharing her pregnancy journey, she had an infant loss. So she lost her baby. She named the baby Jack, if I believe correctly. And so she had lost her pregnancy at the beginning of this month, and it was very hard. So I know she received some backlash for sharing pictures in regards to her experience of her loss, but she's grieving. That's how she may be grieving. And seeing how her platform has been, she shared many different aspects of her life. So this is something that she's experienced. So in many cases, some people feel like they have to hide or keep their miscarriage or different things silent, and they may not share those moments with other individuals. So being able to share that with people, so that way you can grieve. It's not a secret, it's not something that, it's something that happened, and it's something that you are living and dealing with. It also helps with other individuals feeling more comfortable to share their loss. This is something that is not widely spoken about. Usually people keep it quiet in their inner circles. So being able to share that, let them know that, you're doing well, and it's hard. It is hard. So just addressing those feelings and grieving.
And I like when Rebekah said that, because many times so many things are still hush hush. So people are uncomfortable. And again, that was courageous and brave of Chrissy to share her story, because I know it helps some young woman or some woman out there who is experiencing that. And there's such a quietness. People want you to just say, oh, it's over with. Oh, you could have another one, or oh, this or that. People try to minimize. They mean well. I get that. They mean well, but it's still a loss.
Yeah.
And for some people who have infertility issues, it's even a bigger loss, because it could be that they've had multiple miscarriages and no one knows about it, and their desire to have a child of their own. Yes, adoption is excellent, but some people want to have children of their own. And so feeling this way. The other question I want to ask Rebekah is, when she is there at the hospital there and is right there for a mom who is experiencing that loss, and because she is a lactation specialist as well too, and so now that loss, they wanted to birth a child, breastfeed, and there's nothing there for them to go home to. A good cry is always good, isn't it?
Sometimes, yes, it is. And being there for them while they're crying, being there to support them, letting them talk about what they want to, helping to give them resources. Many facilities have chaplains, and we also have resources, which we'll share some information about those, that you can reach out to for different support groups or different ways to be able to talk with others and get some therapy in regards to that loss, to help you as you go through your journey. So there's lots of resources available to help people. And depending on when the loss occurred, for some people, they do have resources available if you need help and assistance with funerals, with different aspects to help you on your journey to recovery, because sometimes that is hard, and the financial burden in regards to that can affect families.
And so I hope you guys hear that. Again, the resources that are available for you to utilize and do. And one of the things I always like, and I'll always go back to, a support system. You have Alcohol Anonymous for people who are dealing with alcohol or recovering. Look in your area, find what's available on virtually, so that you are not alone during this process. sometimes you need to connect with someone else who has been through that with you to just hold your hand, because they have experienced the same similar loss that you have, and so that you're not alone. So that's one of the main things that I want to encourage you to do if you are experiencing anything like that. And when we were talking about earlier, Rebekah and I were talking because she's a healthcare provider, and it's interesting how when people in our family may have an issue, they may not call her, and she hears later on. We're not going to call any names about certain things. And so, what can a woman do when, again, empowering her over her own healthcare, her own pregnancy, if she's having questions? Because we know that there's a disparity in for African American and women of color when it comes to healthcare and having the best services. Help them to advocate, because they may think that something is a little off during their pregnancy, but somebody's telling them, oh, it's all in your mind. What can you do to help them, empower them to at least continue asking questions until they feel comfortable with the answer?
So a lot of times they have resources that you can get information from, like I know, sorry.
We're getting some water.
Yes.
It was a bit much when we mentioned then. Oh, you call her. Okay, yes. Louis, Lindy, yes, you do. But there's some family members who won't. We won't call any names.
Okay. So sorry about that. So there are lots of resources available to you to get information. I know informingbirth.org, they have lots of great information to help you get information.
So what is that? What is that site again?
Informingbirth.org.
Okay. All right. I'm going to put that in there so you guys can see.
Informing.
Okay. I can't even see. So let me put on my glasses. Informing. Okay. Go ahead. Tell them what informing is.
So informingbirth.org is a website that they have great information and resources about birth, and they talk about different things in regards to consent, to getting you information to help advocate for yourself as a consumer, and getting the needs and resources that you need to be able to advocate for your pregnancy, get information on questions or things along that line. So it is great to help if you're having questions or concerns with your pregnancy, always addressing those with your healthcare provider. If you don't feel like you're getting the answers you need, there's lots of ways to get information, so that way you can help find the provider, help clarify with your provider, and also if you need to, find another provider that you feel can meet your needs. Because as the consumer, you want to feel like your concerns are being heard and are valid.
So I want to repeat that. As the consumer, you need to feel that your needs and concerns are being valid or addressed. And so therefore, making sure during your pregnancy, if you have questions, if you have concerns, do that. I love nowadays, Rebekah was sharing with me a friend with this virtual thing, they wanted some alternatives for delivery. And so we have midwifery and all these other kinds of options available for women so that they can have a say and control through the birth of their children. So can you tell us a little bit more about that?
Oh, so depending on what you're looking for, because COVID-19 has changed many aspects of our daily lives, sometimes women are looking for alternative options. So I was sharing with my mom that you have many women now looking at possibly home births, so that way they're able to be in their own home and experience their delivery the way they would like to, without the constraints of being in a hospital. And that there are many resources available to you depending on what you're looking for. And for those women in certain areas, they are able to have a home birth, so that way they can have the experience that they would like and the resources they can access that.
Okay, so again, the whole goal is just so that we can inform you during this time of COVID-19. It is a whole different, different year, whole different way of life. And so giving birth is different, and experiencing loss is a little bit different because with all the things that we've had with COVID, you've had people, over 200,000 people who's lost their lives to COVID. And then if you're one of those people who experience a loss, an infant loss, or a pregnancy loss during this time, it can be overwhelming. It can be overwhelming, and we don't want you to be alone during that. So, as far as any other resources that you can think of for us, for them, Rebekah, or any facts or information that you want to share?
So I think there's a fact that 1 in 4 women will lose a baby through pregnancy or infancy, which seems like such a small number. So a lot of times if you're looking in your inner circle, it's possible that someone may have had a pregnancy or infant loss that you're not aware of. And a lot of times, being mindful, as we talk about, in the way that you make certain statements, as things are changing, people are more open and sharing those experiences, but sometimes it can be hard for someone to share, and they may not feel the support and their inner circle to share those things. So that is one fact that, sometimes you're like, wow, I know 4 people. So that means possibly one person in that group of 4 has experienced that.
And I remember a good friend of mine wanted to have children, and she had like 3 or 4 miscarriages, and it was so devastating for her. And many people didn't know that she had these losses. And it's amazing how insensitive some people are, because in her particular circle, she wasn't considered a woman if she hadn't given birth to a child. So you have that in some areas or some circles or cultures or people. Your parents or grandparents may be expecting that. I don't know how often it is nowadays for the younger generation, but when I was coming up, the question was like, are you pregnant? You have a baby yet? When are you going to have a baby? When you're going to have a baby? Is that something that still happens for?
I believe it is something that still happens. As a mother myself, I've had that comment. I have a child, and when you're going to have another one? So a lot of times being mindful for making those statements in regards to newlyweds. When are they going to have a baby? Because depending on your relationship with that family, you may not know if they've had a loss or that they have been trying and they haven't been able to get pregnant. So being able to be mindful with the way you use your words, because it can be hurtful to them, that asking about, when are you going to have a baby? And they may be trying to have a baby and they're unable to, or they may have had losses that they're just not sharing. And, it can be hurtful. Okay. So just being mindful. So I think it still happens in this day and age.
I know. And so one of the things I do as a coach is I teach my clients how to set boundaries. Many of my clients are young women in their 30s who made a decision to focus on their career, and they have their parent or mom especially like, when I'm going to have a child, when I'm going to have a child. And so that puts a pressure on them, and they think that, I'm getting old. And I'm like, stop. Don't do that. And so then they are trying, and they may have a loss, or they may have had a loss and didn't share with their parents, because then again, the disappointment, you don't want that. So there's so many things that we need to be mindful and consider when we're talking about infant loss and pregnancy loss. So I was trying to, as we told you guys earlier, that October is Pregnant and Infant Awareness Loss Month. And so they have wonderful things to support bereaved parents. So if you find that you are one of those people, um, keep that in mind. And if you know someone, one of the things they say how you can support is perform an act of kindness. Could you imagine if you were able to do that for someone that you know who's experiencing that? One of the things that they actually suggested too is for you to send a letter to your elected official urging them to support legislation and policy designed to prevent stillbirth and other poor outcomes and provide improved support for families. And so that is very important in itself. I remember years ago, I used to be a case manager in the Virgin Islands, and we had a high infant mortality rate. And so we did have women who had infant loss or pregnancy loss, because one of the great things to have is a great NICU, a neonatal. Yes. So is there a way for a mom who's pregnant to find out ahead of time if the hospital she's going to deliver has a NICU?
Yes, with today's technology, a lot of facilities, they advertise about their maternity units and their infant care units. So it is possible for you to find out what level NICU they have, whether, because they have level 2s, level 3s, and level 4s. So finding out what level NICU facility that you're delivering has, so that way you know, depending on if you know your baby's having issues or it's going to be preborn, preterm, so your baby can have the best resources and access to care. So a lot of times the differences are a level 4 considers that they do surgeries and procedures, whereas a level 3 facility will take care of critically ill infants and neonates, but a lot of times those facilities do not perform surgeries. So a lot of times if you have a baby who's having an issue that's going to require surgery to resolve it, they may not have that facility capability and will have to transfer your baby to a higher level of care. If they're not needing any type of surgical interventions, a lot of times a level 3 is satisfactory to help with a preterm baby that may just need time to develop since it was born prematurely outside of the womb.
Okay, so I like hearing that because I wasn't even aware of that, the different levels. So I hope any of you out there, if you find that you're having some issue, find out where your doctor delivers and do a tour of the facility.
So I know right now with COVID, a lot of places aren't doing in-person tours, but they are doing like virtual ones. Some facilities are offering options where they do like a virtual tour. They have different virtual classes where you can ask questions and things like that to gain research and along those lines. That way you can get the information to know that you are going to have the best care for your baby if needed. And like if you deliver at home, also researching the facilities close by in case you do need them, so you know which one that you would be willing to go to, and that's going to have the care that you need for you and your baby.
Okay, and I like that because again, they are doing things virtually sometimes, so it's not always feasible, but asking the questions, so or even researching the hospital, because you should be able to find that information on their website, you know, what level care for their NICU. I know in the Virgin Islands, they were so happy to eventually get a NICU doctor to help with our infants who were born prematurely, who needed extra special care, our little people. And so that's just so important that you are aware of that. You may not need it, but I like for us to be prepared. You don't want to wait until you need something to find out if they have it. You can be proactive and find out what resources are there for you. So in case anything happens, you definitely have someone to step in there and do. Because one of the other things that I like too, that I need you guys to keep in mind, is to have someone to advocate for you. So now you may be in the midst of that, and so you don't know what to say or what to do, but having someone who will advocate for you. Oh, because what does that look like, Rebekah?
So in some aspects, people have doulas that they've hired that will help them throughout their pregnancy and delivery, and they are great resources and advocates for you. If you don't have one of those, if you have a friend or family member that you consider close, having someone who knows your wishes and what you would like to be done to help advocate for you and also reassert what you're saying. So a lot of times, sometimes your voice can be lost and things, even though you're speaking up for yourself, you're still struggling and going through things. So having someone that you can have be there for you to be that resource and advocate on your behalf is important. And there are many aspects along those lines.
And so I know, again, a conversation my daughter and I were having. One of the conversations we have is like, what happens as I get older, what I may want for my wishes. So people don't like to talk about death or dying. And for your birth plan, I know someone doesn't want to think that their pregnancy will not be successful. But again, learning to have something in place so that if something were to happen, they would at least know what your wishes are. So I don't plan to die anytime soon, but I let my children know what my wishes are. I don't want to, not that they could do what I want them to do or not, but because I'm in control of my faculties now, I can have a conversation and say, this is what I would like. This is where I would like to live if I am no longer able to care for myself, or when I no longer have if heaven forbid, have amnesia or Alzheimer's. So again, for a birth plan, it may seem a little bit, I don't know if it seems presumptuous to say, I plan to have a full term, but if I don't, these are my wishes, because I think in the midst of it, it's kind of hard to make those decisions.
I mean, it's possible to have that, to have your have things planned out in a sense, so that way you know your wishes are met. Having a power of attorney is great too, and a living will, just so you have different things in place should something happen in the aspect of everything that's going on and you're incapacitated. So there are different ways that you can establish and have your voice, or things that you can plan ahead of time or address prior to that situation, so that way you can share that with those important to you. Also discussing those things with your partner, the people who you plan to be with you throughout the process.
Okay, yeah, because I know that even for day-to-day life, if I'm distracted and you ask me a question, I'm just like, all of a sudden it's like, I don't know what to do. I could have been making decisions fine, but all of a sudden I'm like, I don't know what to do. So depending on your personality type, you may numb yourself and are able to go through with it, but others may have a point where they're just like, I can't believe that I'm going through this right now, and I just want to curl up. One of the things that I think is actually wonderful too, especially in this virtual day and age, is you could Cash App somebody some money. Cash App them something so that they don't have to go out and make dinner, to think about that, or order, so they can order some food in during this time when it's just like, oh, I just don't feel like doing anything because all I'm doing is looking at my baby's crib.
So yeah, that is one of the positive things that you can do, different things along those lines. Now you can order groceries, so you can have someone have things delivered, so that person has things they need and they have less trips that they have to make out to the store or with those around them.
Okay, we have a question. Have either of you experienced infant loss? No, I haven't experienced infant loss. So it's just, but I've had good friends who have, and that's really, really hard. And so just to support them with that. So, and I like what you said here about create a birth plan. And so often we do business plans, we do, some of us are so organized, we have our life planned out, we have our daily schedule. And so having a birth plan, just like when we do fire drills or tornado drills or hurricane drills.
So different things you can have, like she said, you can have a plan in place. You can address things, and they are uncomfortable topics to discuss, but you can talk about different things and lay out what would you like to be done given certain situations or scenarios. So that way you and the people who are close to you or important to you know your wishes or what you would like to be done. So that way they can respect them.
Mm-hmm.
You can respect them, and you have them also as your advocate, knowing, hey, this is what Rebekah would like done. You know, she's stated this and we're supporting her. Mm-hmm. So if someone doesn't necessarily agree with that, it's like, well, this is what she would like to do. Mm-hmm. So we have to respect her wishes.
Yes. And again, having someone really there in your corner, because you're vulnerable right then and there. And sometimes they just want to push and do what they want to do because it's expedient. And so remember, this is about you. This is about you. And so I want you, anyone out there who has experienced pregnancy or infant loss, I'm sending you a big virtual hug, because sometimes you just want to hug. You just want to cuddle with that one. You may have had the brief time of having skin to skin with your child, and then all of a sudden it's not there. And you still may have milk in your, and there it is, your whole body is going through a phase as though it has delivered a child, and it's not there. So again, finding someone who you can talk to and share those little things with is so important for you. Anything else, Becca, that we may have overlooked?
And like she shared, the resource she shared, they also have information about lactation after a loss, because as she shared, some people may have you may have an infant that you lost that you were breastfeeding or feeding, and they tell you ways to deal with that. So it's not a quick fix, but there's ways for them to dry up the milk that they have in their breast during that time because of that loss. It's hard dealing with that coping. Some women donate their breast milk because of that loss, and that's their way of giving back, or it helps them with their grieving. So it does have lots of information, and we definitely will share more links of information that you can use to have resources to help you with coping with a loss.
Yes. Okay. So I know many of you are finding this helpful. And again, you can definitely share this to anyone else or tag them so that you will know what resources and different things are available for you. On that same Star Legacy website, they have resources on how family and friends can help during this time. They even have a stillbirth summit that they're going to be doing in 2021. They actually have podcasts. So one of the things that I find helpful is definitely to get information on something that you are going through. Don't try to sit there and figure it out by yourself. Find a community. And if you have someone who doesn't understand where you are, you can find someone, a group. The internet and finding support systems are awesome. You can definitely do that. So I want you to definitely keep that in mind. Hi, Vera. Thank you for tuning in. So I definitely want you to keep that in mind when you have someone who you are talking with or doing. And what's that statistic, that one over about almost 1 in 10 OBs? Share that statistic with them.
Oh, one of the statistics on that same website says that almost 1 in 10 OBs will be so devastated by a stillbirth that they may consider a change in career. So a lot of times it does hurt your providers. Sometimes as healthcare professionals, we feel the pain with you, like with the loss. So a lot of times being there and the deliveries and the birth, it's hard for everyone. So being there to help support you, and it's a very sad and challenging time. So we are there to support you. Sometimes we cry with you. So there are lots of resources. So it is hard on a lot of people. And the more we have these open discussions and address these things, it helps to make it a little bit more comfortable to have these conversations and topics.
And again, I'm going back to my days, putting on my case manager hat. Back in the day, I'm a great proponent for prenatal care. So as soon as you realize you're expecting, getting prenatal care is so important. I remember telling my clients prenatal vitamins. It's as a woman who is menstruating and going through different things, there's so many things that's happening in your body, and now you're going to have a little life that is needing sustenance as well too. So as soon as you know, definitely getting prenatal. I know there are many stories out there that some people don't even realize they're expecting until the month they deliver or when they deliver. So I know that happens, but prenatal care is important. Wouldn't you agree?
Yeah, prenatal care is important, so that way you're getting the best care for you and your baby, identifying things and addressing things to help with certain aspects that can help prevent those things. So prenatal care helps. A lot of times if you are more at risk for miscarriages or loss, getting early prenatal care, there are lots of resources your provider can do to try to help you with those things, and making sure you're sharing that information depending on if you had a different healthcare provider during those losses. So communication is key to help get you the best care going forward as a consumer. So I say getting prenatal care, getting care as you know it. So you want to, if you're getting your normal care, so that way you can address different things in your body to help be a more healthier you.
Okay, because so the more you know, the better,
Yeah.
Because a lot of times there's certain things that we have no control over. And if it happens, it happens. But as much as humanly possible for the things we do have control over, that is what we want to empower you with. There's certain things that are going to be beyond your control and there's nothing you can do. So there's a question there. One of my friends had an infant loss and was upset at the father's lack of emotional support. Any advice to mothers who experience this?
So then again, we have people who grieve differently. So a lot of times you have people who grieve differently. And in certain scenarios, men sometimes don't show their grief as openly as women do, due to many factors. So a lot of times, sometimes, like Carla said, counseling is a great resource, so that way you can both talk to each other and address things. You want to try not to attack the person and how they're dealing with their grief and an infant loss. It is hard on both parties. And a lot of times everyone takes their own fault that they feel in regards to why this happens. And they blame themselves sometimes for different reasons that they may or may not share. So talking those things through, and a lot of times it's a hard situation, but therapy or speaking with someone, so that way you have someone to be the person to help mediate the situation, so you both can share your feelings and your concerns, so that way you can hopefully address those issues, whereas that person may have felt they were being as supportive as they could be during that time, or they didn't realize that you felt they weren't as caring as they could have been. So a lot of times it's a hard situation on both parties. So making sure you can talk about it, and you don't want to beat down each other or say mean things, but you want to share your feelings, because your feelings are valid, and address those, so that way hopefully you can come on a common ground and meet somewhere in the middle with how you're feeling during those losses.
And I like when Rebekah talked about understanding that people may express their emotions in in various ways. I know Rebekah and I, we have our discussions because I express my emotions in a different way, and she wonders about me sometimes. It's like, oh, it seems like you don't care. So it is true that when you're dealing with a loss, especially, someone may want to cry, someone may want to curse, someone may just be stoic and quiet. Someone may just want to be alone. Someone may want to be with their friends. Somebody may want to go out and drink. Somebody, we don't know. We don't know. And again, when I talk about us being compassionate, knowing that, yes, we may feel as though they're not being compassionate as we are or not there for us. But this is when I say you learn to use your voice. Many times we assume that someone knows what we want. And so it may make you a little bit more vulnerable to say, for me to say, Rebekah, I need you to hold me. Because in her mind is like, oh, why I may need to hold her? Or your partner may not think that. And you just will have to give voice to your need and saying, I'm feeling needy right now. Or you may say, I want to be alone right now, because the partner may want to be with you all the time and you may want alone time. So whatever that looks like for you, if you need something from that partner, and even after you say what it is and they refuse to give that to you, right, there's nothing much you can do. But you definitely can say, hey, I'm feeling so, whatever you're feeling, and let them know what it is you need. If you need your hand held, if you need to sit in their lap, if you just want to cry and say, you know what, I may cry for the next month or two. Please give me that freedom to cry without saying, oh, stop it, because this is how they're expressing it. For someone, they may say, I want to just be quiet for a while. So don't think that I don't care about you. I am just in my head, and I may sit there with you and don't say anything, but I'm aware of you. So whatever that is. But to answer Lewis's question, if that mother is feeling that, because this could be a trying time and relationships can break up, I would say find some help.
So it is pregnancy and infant loss. A lot of times they say divorce rates are increased. So a lot of times relationships can be greatly affected because of the pregnancy or infant loss. So a lot of times dealing with those issues and concerns, so that way you're able to work through it, because it is a hard experience on both parties. Mm-hmm. And you have to be able to meet in the middle, and it's going to be hard. Some stuff is not going to want to be talked about or addressed. So it's just going to be something that you have to work through, and it takes time.
Now, one of the things, or kind of infant loss, we hadn't talked about, because we haven't heard any of those things in the news recently, but I knew like a year or two ago, we had quite a few times where people were left their children in the car, and someone forgot. So that kind of loss, oh my goodness. Yes, someone may feel as though it's somebody's fault because they forgot or did that. And again, during this time, when that happens, that person is already berating themselves so much, and they don't need others making them feel bad for something. So counseling, dealing with that, because that's traumatic. Loss is traumatic in any way it happens, and so making sure you ask for help is just so important, guys. And I can't stress it enough, being compassionate for others, whether we know it or you may think you know something. Be compassionate. Err on the side of kindness. Can you go wrong if you err on the side of kindness? So do that. One of the other things too on that particular site with Star, and as Rebekah said earlier, if the person wants you to call their child's name, I know it's so interesting. Sometimes when you have a loss, even if it's someone who lost their lives in the service or a child, is like you never know, is it okay to talk about them? But I remember reaching out to somebody one time and said, do you want to talk? Do you want to share a story or want to share an experience about a loss you had, what you were feeling like? And they just loved that they could talk about it, and it brought a smile to their face as they remembered certain things. So when you have a loss, again, finding out from the person what they would like, but sometimes we want to pretend that it never happened and ignore it. And they may want to talk about it. They may want to talk about their Susie, their Mary, or whoever it was.
And being supportive of that. So it's always acknowledging what's in the best interest of that person. So if they're wanting to talk about it, not forcing them to talk about it, some do not. But if they want to talk about it and they're open, being there for them. Sometimes there may be tears, so just being there and be supportive.
Yeah, always good to have a little tissue close by, because again, a good cry could be so cathartic during this time. So thank you guys so much, as we've been talking about infant and pregnancy loss for the month of October. And again, you may not have experienced it, and you may be a young person or a young woman who knows someone, or in the next few years, if this should happen to you, I want you to know that you're not alone in this journey. And again, I'm going to put up the website that, I left off the www. I see when you can't type in correctly. Let me make sure. When you don't have your glasses on, and you are trying to type. So let me do that. Let me remove that one and show you the correct one. So I tell you, that is too funny. So it's informingbirth.org. Informingbirth.org is a resource that you can definitely contact or get in touch to get information from. And I believe they have a Facebook page as well.
Yes,
too?
They have a Facebook page, and they also have an Instagram page as well. So they offer great resources to be supportive for you. I know they have offered resources for people who've had losses. So it's a great resource for great information.
And now we're going to be winding up, but Rebekah, I would like for you to let them know how they can contact you or follow you on social media, please.
So if you need to reach out to me, I am at Little Ones Lactation Services on Facebook and Instagram. You can send me a Facebook message or message on Instagram. You can also reach me at littleoneslactation@gmail.com. If you have any questions, concerns, or need information on resources or services to best assist you in whatever you're going through, whether it's pregnancy, infant loss, motherhood, parenthood, however, what kind of aspects, we have lots of great information and resources available.
Okay, because again, I'm through with my birthing years, but I definitely enjoy looking and following her page as she empowers moms and dads, because they can be instrumental, very active in supporting the desires of their partner for the rearing and nurturing of the child. So it's so important. But you can definitely find her at Little Ones Lactation, or send her an email at gmail.com. She actually does virtual coaching for women who just need lactation support. It's amazing what she can do a Zoom session to really just help a mom latch on and do that. So I know that's not what we were talking about today, but I just wanted to put that out there for any moms to be who are coming along, so that you know that there's a resource there with her, because so often you can feel so alone. We no longer have those communities where you have the mother, the grandparent, or the aunt right there with you who can share their wealth of knowledge. Many times you're giving birth and you may not have your extended family there. And so therefore, being able to reach out to someone who can give you the support you need and just find resources for that. And that's what I'm excited with Rebekah and what she does. So even when it comes to birthing, she was doing a course for dancing, for helping ladies, so that how movement.
So yeah, Dancing for Births. They also have a Facebook page, but it was a great class. They train you how to be an instructor to help people with dancing, to help with birthing their baby, even postpartum. Different ways that they help. They say dancing helps with dealing with different aspects in your life, how relaxing and the benefits from it.
Okay. And as I said, this month has been a month with different things. So actually our guest for next month, and it's going to be at a different time. I'm not sure what time yet because I have two things that are conflict on my schedule already for next Sunday. So we're going to have it. It may be later on in the evening for next Sunday conversation with Carla, but we're going to have Donna, and she's going to be talking with us, and we're going back to the subject of domestic violence that we talked about last Sunday, because her story is a unique one, because she was in the church. Her husband was in the church during that time, and I think it's very important as young women, older women, to be mindful of what it looks like and how you can cope with life after abuse. And hopefully some of the things we share with you, you're able to recognize it before you get in too deep in a relationship that is going to be abusive. So that's what we're going to have for next week. And then the following week, we're going to have someone who's had a miscarriage, and she's going to share her story with us and how it became a ministry in its own way. So I'm excited about Vera, I'll turn some people to your email. Oh, thank you for sharing that email with others, Vera. So I'm excited about the rest of the month that we have for October, and it's already over and done with, but I'm excited for it. And 2020 has been unusual, guys, but we can make lemonade out of lemons for 2020. We can do this. So thank you again, everyone, for tuning in to learn a little bit more about pregnancy and infant loss awareness. I want to remind you that October 15th is the what, Rebekah?
It's the candle lighting ceremony for World Pregnancy and Infant Loss Day. So they recognize it. A lot of places usually do lighting candles in person. I believe majority of them are doing it virtual. So there'll be an opportunity for you to light a candle at home for someone who's experienced a pregnancy or infant loss.
Okay, so that's there. And like I said, we've posted some of the resources that you can find. And when I get a chance, I'll actually post Rebekah's Facebook link. So you can definitely find her, to follow her either on Instagram or on Facebook to continue to get more information and resources. So I hope you continue to have a wonderful day today. And take care of yourselves, manage your stress, improve in your relationships, learn to set boundaries, learn to be compassionate, learn to be kinder. I say, make us a kinder, gentler nation again. But anyway, my name is Carla. I'm your relationship doula, helping women and men bravely birth peace in the pieces of their lives. Thank you guys for tuning in. See you guys on Facebook. Bye-bye.
Bye.